Worldwide, pain is one of the most frequently occurring healthcare issues and has a major impact on people's lives. Targin is a highly effective opioid analgesic for the treatment of chronic severe pain. Targin is a unique combination tablet consisting of an opioid agonist prolonged-release oxycodone and an opioid antagonist prolonged-release naloxone. Targin, through its oxycodone component, is designed to provide patients with effective, centrally mediated analgesia, while the naloxone component counteracts locally mediated opioid-induced constipation. This helps patients improve and maintain bowel function. All patients receiving opioids are at risk of opioid-induced constipation, and it has been reported in up to 90% of patients. On ingestion of the Targin tablet, oxycodone and naloxone molecules are absorbed by the cells of the gut and enter the bloodstream. Opioid receptors are located on the neurons of myenteric and submucosal plexi of the gut, and on the epithelium. The binding of opioid agonists to these receptors causes reduction and discoordination in peristalsis and increased fluid absorption. In turn, this causes a number of adverse events, including opioid-induced constipation and bowel dysfunction, which can cause additional health problems such as nausea, bloating, severe abdominal pain, and gastroesophageal reflux. In severe cases, opioid-induced constipation can result in patients having to be manually evacuated, which is a highly invasive, time-intensive, and costly procedure that requires hospitalization. With Targin, the majority of oxycodone molecules pass through the liver unchanged, allowing effective systemic analgesia. Meanwhile, the naloxone component of Targin binds the mu receptors with 1,000-fold greater affinity than oxycodone. This inhibits the binding of oxycodone and its local effects in the gut, allowing the patient to regain normal bowel function. Of the molecules transported to the liver by the portal circulation, more than 98% of naloxone molecules undergo first-pass metabolism in hepatocytes. Therefore, with normal hepatic function, the systemic bioavailability of naloxone is negligible, and the drug is removed from the circulation before it can access the central nervous system, and so the opioid antagonist effects occur only locally in the gut. In contrast, the 3-methyl groups of oxycodone protect it from first-pass metabolism, and consequently, the bioavailability of the oxycodone component of Targin is approximately 90%. Oxycodone alone enters the central nervous system, and it has been hypothesized that the oxycodone interaction through mu and kappa receptors might be associated with its analgesic effect in clinical practice. Opioids exert many of their effects at receptors of the primary afferent synapse and modulate signaling between several types of neurons in the spinal cord, medulla, particularly the brainstem, and the brain. In the dorsal horn of the spinal cord, opioids reduce the frequency of the pain signals reaching the higher processing centers in the brain and enhance the activity of the endogenous analgesic system via the descending pain control pathways. Consequently, patients who take Targin obtain effective relief from chronic severe pain, including cancer-related pain, somatic, visceral, and neuropathic pain, while their bowel function is improved and maintained. By providing strong analgesia and helping to regain bowel function, Targin is the first analgesic that facilitates effective pain management for the physician, while improving pain management for the patient.